Welcome to the Wellness Revolution podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here is your host, Dr. Veronica.
Welcome to another episode of Dr. Veronica's Wellness Revolution. Again, we're going to talk about an issue that hits practically everybody in life at one time or another. Now, one thing that I know from being a functional medicine specialist is that fear, anger, and sadness overcome everybody at one time or another in life. And today in the United States, there are more prescriptions written for people for anxiety, depression, and all these mental issues than there are actually people in the country. Imagine that. So what does that mean? There are people like me who aren't on anything. Does that mean somebody else is taking mine? More prescriptions written for anxiety, depression, emotional issues than practically anything else in our country. So what does this mean? We're all having a little bit of trouble, but besides having the trouble and getting the prescriptions, you get on the prescription, you can't get off of it, it's not getting better for whatever you have, and we now know that they cause major side effects and even other health problems. So they mess up your brain, your neurotransmitters, put them out of balance. They don't put them back in balance. So what happens is sometimes you end up with a worse problem than you had before you started the pills. So you're saying to me, well, Dr. Veronica, what do I do about that? Because what are other answers? I went and I yacked with somebody. I laid on the couch and I still was walking around between these visits, feeling anxious, feeling angry, just depressed. So what do I do? Well, yes, there are answers. And today I bring to you a lady who is a Harvard graduate, an NYU graduate, two very prestigious institution, who is also the psychologist in The Angry Couple, teaching people how to do couples therapy, helping other therapists do couples therapy so that more couples can stay together and be happy, maybe. I bring to you Dr. Susan Heitler. She's a clinical psychologist, and we're going to talk today about prescription without pills. So that is her book, her website, prescriptionwithoutpills.com. I wanted you to see that. And then you're going to get to see her book, but we're going to talk today about prescription for fear, anger, depression, all these emotional issues without using pills, because I know that's what you want. Dr. Heitler, welcome to Dr. Veronica's Wellness Revolution.
A pleasure to join you.
So first, tell us a little bit about how you got into psychology in the first place.
Oh, that's a great question. And my mother would watch me when I would manipulate, really, my younger sister and brother to get them to do what they wanted. And she often said, Susan, you're a great psychologist. So I guess that's been my identity for a long time.
So you started this as a little kid in elementary school, working with people, pretty much.
Right.
Okay. So most of the time, you have psychologists and you have psychiatrists. And for the general public, if you don't know the difference, the psychologist usually goes and gets the PhD. They generally don't prescribe medications. The psychiatrists are the pill pushers usually. They're MDs. They're supposed to do the talking and everything else, but in today's world of sick care, they have 7 minutes and they give you a prescription in those 7 minutes. And even family practitioners and internists are writing prescriptions for all these medications. So Dr. comment on that.
Yes, in addition, it's a good description. of the difference between psychology and psychiatry. We do it without pills. They're specializing in pills, and there are times when pills are appropriate, in which case I call one of the psychiatrists I work with and say, this fellow needs medication. In addition, though, to helping people to go from feeling depressed, anxious, angry to normal, psychologists also specialize in understanding how people function when they're healthy and how to coach people, for instance, in better skills as a couple. In the case of my book, Prescriptions Without Pills, I coach readers in how to handle those normal negative emotions in ways that lead to good outcomes. So they feel better and they solve whatever problem provoked the negative feeling.
So you talk about anxiety having an upside. And so, you know, we feel a little bit uncomfortable now. We just want to get rid of discomfort. We want to numb the feeling. Some people self-medicate with cigarettes or food or alcohol. Then the rest of the population says, I'm not going to do any of those things that are illegal. I'm going to go to my doctor and get my prescription for Celexa or Zoloft or Prozac or Lyrica or whatever is the famous drug of the day. But you say there are upsides to anxiety. Really?
Yes. There's upsides, for instance, to pain. If you get a toothache, it really hurts. What is that toothache there for? To tell you you've got a serious problem in a tooth. So if you take pain medication so you can't feel that pain, that misses the point. You need to go to a dentist and get the cavity or whatever's wrong with your tooth fixed. The same with the pain of anxiety. It's there to tell you, oh, there's something that's a problem lying ahead on your life path. You need to pay attention and think about what to do. Once you begin thinking about the problem solving, the anxiety goes away.
So let's just talk a little bit more present day. Now, some people will see this video way after the fact, maybe even years after the fact, because this is the beauty of the internet. But we've just gone through 2016, a tough year where we went through an election where it seemed like the whole country, no matter what side that they were on, or even if they weren't on a side, were feeling anxious, depressed, angry. What do you say about those type of emotions that don't necessarily have something to do with what's going on directly in your life, but are causing, you know, psychologists, I don't know if you did, were seeing an increase of anxiety in their clients during the election.
And after the election, even more so for people who are on the side that lost. Depression, anxiety, panic. So what can you do about those? Well, in that case, it's a problem that you don't really control. So there's really not much you can do to change the outcome of the election. What can you do? One thing you can do is decide, is this a problem I want to stay focused on? Or do I need to just switch my attention somewhere else? When there's an anxious feeling, for instance, when I'm in an elevator, I feel anxious. I have the same two choices as someone post-election. I can cope with the anxiety by distracting myself, bring a magazine along with me, or in the case of post-election anxiety, focus in on something else that you do control in your life. Your kids, people you love, doing good things for people, your work. So that's distraction. The alternative to looking away from the anxiety is to just notice it, experience it. Psychologists call it mindfulness. There's a funny thing that happens when you focus on a feeling and just watch it. You don't judge it, you don't panic about it, you just observe the feeling within you. There's a tendency for feelings to be like a wave. They rise and then they dissipate.
So you're talking about you were just going through, I assume, some of the techniques that people can use to get rid of anxiety. But most people say, How am I supposed to do that? How am I supposed to not focus on it? It's everywhere. I log onto the computer, it's there. I turn on the TV, it's there. It's everywhere. So how can you possibly tell me don't focus on it?
So it's hard to not do. You have to say, I will focus somewhere else. So I will start playing games with my kids in the evenings and helping them with their homework instead of watching the evening news. Or I will skip the front page of the newspaper and just go on to read the sports. There are ways you can distract yourself in that regard.
Okay. So
now, there's another technique also that's kind of interesting. It's
okay.
almost religious or spiritual, which is faith. So religion gives us several positive assets. One, religion teaches us to have gratitude, and we know gratitude makes us feel better. And religion
yes.
gives us faith. So gratitude, in the context of the election, was what might be something like, we are so lucky that we live in a democracy where the rules are very clear. In 4 years, if I'm unhappy with this president, I can work to get another president elected. And the people speak. If this president really does not do a good job, the people will speak again. The second, faith, as opposed to gratitude. Faith says, you know what? It's going to be okay. I'm going to trust that our system works. So, and our system's a complicated one. So this is not a tyranny where one person who is elected president has all the power. The president works with a lot of advisors. Anything the president wants to do has to be in association with Congress, which has lots of people who think for themselves. There's also the courts. So if the president begins to act too tyrannical, the courts will say, So if you have trust in the US and faith that the democratic system works, and worst case scenario, 4 years and you can work to get a new president. Those also are active ways you can allay your anxiety.
Okay. So when you talk about having faith and trust, it seems that at this particular time in history, a significant number of people, and maybe it seems different, but a significant number of people seem not to trust and not to have faith. And it seems to be getting worse in that sense, that less and less people are trusting and having faith. So when everybody around you is experiencing this lack of trust and faith and anxiety, how do you tell people to stay calm? What can they do to stay calm?
The centrally most important way to deal with anxiety is problem solving, doing something. So even today, this week, with the new president not yet even in office, if people really say, this is a problem, the person who's in office is not okay by me, you can begin right away to go to the political party of your choice and begin working toward 4 years from now having a different set of choices. That's problem solving. That's taking action toward getting the outcome you want. Shall I give you a little background? I call it the hand map.
Yes, go ahead.
Solving is so important.
Yes.
The hand map goes with what I call bump theory. So as you're walking along the road of life, see this bump at the beginning of your hand?
Yes.
Life has bumps. Could be someone did something you don't like, could be you couldn't figure out how to do something you wanted to do, or the bump could be someone was mean to you, the wrong presidential candidate got elected, all kinds of bumps. Once you hit a bump, you have 5 options. 1, 2, 3, 4, 5. If you take the problem-solving route, you'll end up feeling pretty good. You'll circle around till you hit the next bump. And if you keep taking problem-solving route, you live mostly in the realm of well-being. If, by contrast, you take one of the four-finger detours, ooh, it's not such a pretty picture. If you get mad to get what you want, it's often ineffective, or you get in the short run what you want, but you lose important relationships. If you don't want to get mad, the second finger represents giving up. If you give up, you feel depressed. So if you don't want to give up, but you don't want to get mad, and you've forgotten that there's problem-solving route, the anxious route is to let that problem just hover there, do nothing about it. So if you're anxious about the election and haven't thought about a plan of action where you can do something to make at least a small difference, then you're at risk for staying anxious. Then the fourth route, because anxiety is so unpleasant, as is anger and depression, there's the escape route, and that's to addiction. So the hand map explains the unfortunate paths that people can take in response to a life bump.
So you also talk about making anxiety helpful. How do you make your anxiety actually helpful?
I'll give you an example. One of my favorite cases, because it was so dramatic, and it actually has a funny ending to the story, a poignant ending. So I saw a woman, she says, I just feel chronically anxious. So the appropriate next question is to find out what thoughts provoke the anxiety. So close your eyes and what thought comes up? The woman said, let's call her Margaret. Margaret said, I'm afraid I have cancer. Oh, so what have you done about it? Well, it's in the lower part of my abdomen, so I went to my OBGYN, and I actually really like him. He's been my doctor for years and years. And he said, stop being such a worrywart. You're fine. But I'm still anxious about it. What's missing? She stayed anxious because she didn't take enough of the problem-solving route. So why don't you go see another doctor? I asked her. She said, well, he's such a nice man. I don't want to hurt his feelings. I said, that's very generous, and you need to find a solution. Well, I don't know who else to go to. So I said, just a minute. And I went to my telephone, made a quick phone call to a physician. I'm at Rose Medical Center, a medical center. So I called a physician I know within the medical center. He said, look, just send her over right now. I'll tell my secretary to put her in right now. I said, let's get information. The best antidote, that's not my phone, I assume.
No, it's my phone, of course. My fax machine.
Wow. The best antidote to anxiety often is information, because information begins the problem-solving process. So she went down the hall, she saw the OB. The OB called me back and said, this woman, I can feel is filled with cancer. I've scheduled her already for 2:00 surgery. Anxiety was her friend.
So she had it.
She did have it. It did save her life. You want the ending? I'm not sure I can tell it without becoming emotional.
You got to tell me the ending. Yes, of course.
Many years later, just 2 or 3 years ago, I had a serious physical problem and ended up in the hospital. Everyone took care of me. It was looking like it was great. And one of the nicest of the nurses came up to me and said, Dr. Heitler, do you know who I am?
That lady.
Yeah. It was that woman.
Wow. How cool is that? So
Yeah.
probably like changed her whole trajectory of what she's doing.
And
So
it begins with treating anxiety respectfully. It's your friend. It's there to tell you there's a problem. And by her seeking more information, and we found a solution, which was surgery.
So what do you tell people today where, okay, this lady, you were there and you said, go get another opinion. And she did go get another opinion. But today, a lot of people chronically worry. They surf on the web and they worry some more. What about those chronic worriers that don't take action? Or if you're just built like that, you worry about everything. You were born worrying.
Yes, that's a funny phenomenon. Some people, instead of being in the present, they're quickly jumping ahead and envisioning worst case scenarios. That's worrying. Or that's creating issues to worry about. Or once they have seen a bump ahead, again, they don't move from seeing the bump into problem solving, gathering information, figuring out what they can do. So if you're worrying, it means you're just spinning your wheels on anxiety road instead of addressing the problem and finding a solution. Can you, sometimes people say, well, what's the difference between worrying and problem solving? Worrying is just over and over the same thought. Well, what if, what if, what if? Just like spinning your wheels. Problem solving involves gathering information, moving forward, thinking of a solution, implementing the solution. Very different.
So let's switch over. You have your lovely book. I'm going to say, hold up the book. Prescription Without Pills. Prescriptions without.
Actually, about 60 prescriptions in there for depression, anger, anxiety, addictions, relationships, and some more along the way, like well-being.
So give us some example of a prescription without pills.
Okay. A prescription for anxiety. You're feeling anxious. You're not sure why you're so anxious, but you know you're really anxious. Sit down, close your eyes. First, locate that anxiety within your body. So someone might say, I'm thinking of Patricia. Patricia said, oh, it feels like a big fiery ball in my chest. Okay, as you picture that big fiery ball, about how big is it? She said, the size of a grapefruit. That's how it feels anyway. Okay, next step. What thought would make that grapefruit even bigger? Patricia said, well, my mother died recently, and the scariest thought for me is that my sister is going to steal my whole inheritance. How big is that grapefruit now? Oh, it almost doubled in size when I thought about that. Okay, close your eyes again. What other thoughts come up? One of my other sisters is probably going to support her. Other thoughts? I have no idea what to do about the inheritance. Any other thoughts? My mother would be very unhappy in her grave if she saw this happening. Okay, now we have a list of maybe 4, 5, 6 concerns, all of which expand that grapefruit, that feeling of anxiety. It's a good idea when you're doing this on your own to make an actual list, write down each concern one by one. When I'm working in my office with clients, I'm the secretary that writes down each of the concerns. Once we have all the concerns, all the thoughts that make the anxiety larger, then I say, okay, you can open your eyes now. We're going to go one by one through each of these concerns. We're going to treat them as problems that need solving. Let's start with, oh, my sister's going to take the inheritance and I'm clueless about what to do. Who could you go to? Where could you get information about how to handle this situation? So we talked through one by one. By the end, Patricia had figured out a complete plan of action. She would talk with her sister to try to influence her. She would talk before that with an attorney. She would go to an attorney friend that she had for starters, and then rely on that woman to steer her in the right direction for further information. Now already, Patricia, instead of being frozen like a deer in the headlights, anxious and worrying, now she's beginning to move forward. Did she like the situation? No. Was she still so anxious? Well, let's ask her how big the grapefruit is. how big is that burning area in your chest right now? I asked Patricia. Patricia said, oh, it's more like a ping pong ball. And actually, when I picture myself moving ahead with our plan, it almost shrinks to the size of a pea. I still don't like the situation. I'm still, uncomfortable about what will happen. Only it's a radical difference. I can keep thinking and problem solving and taking action now.
With prescriptions without pills, are there any ways that you help people get off of their pills? Can you help people get off of their pills?
I'm having a little hearing problem here. Thank you. Yes. As people do that kind of problem-solving process that I just described, where they list all their concerns and then map a plan of action, they don't need pills anymore for anxiety. As a result, you can skip the pills altogether and just go straight to focusing on the problem in this way, where you break it down into all the specific concerns that you have.
A lot of people want to get off the pills, and do you recommend that people read a book and take themselves off the pills? Or, because this is the day where everybody's, I like to joke and say everybody's got their PhD for WebMD because they've read everything. We read prescription without pills. Can I just read this and then wean myself off the pills, or just stop taking my pills? What do you say?
So it depends what kind of pills. One set of pills, the benzodiazepine pills, are highly addictive. So speak with your doctor and work with him to get off them. Addictive means the more you're on them, the more you just have to take them, or else you feel just terrible.
And can you name some of the common benzodiazepines so people know?
My mind's going blank because I dislike these drugs so much. I try to.
I want to say Xanax.
Exactly.
Ativan.
Right, you got it. By contrast, many people, many are on antidepressants, often because antidepressants also can reduce the anxiety. Some of them reduce anxiety. They slow your whole system down, your nervous system. Those pills have a different problem. In theory, they're non-addictive. That's what your doctor will tell you. Oh, these aren't addictive. What they do is make you drug dependent. Now, what's the difference between addictive and dependent? When you're addicted to something, you can't wait to get your next dose. You just got to get it. Like if you're addicted to work, you can't wait to get back to work. By contrast, drug dependent, nobody says, oh, I love taking my antidepressants. It doesn't give an immediate calm or an immediate high. But what happens is your body becomes dependent on it. So if you don't take your medication, then that can trigger you into a deep depression. Even if you were taking the medication basically for anxiety, when you withdraw an antidepressant, unless you withdraw it very, very slowly, so again, talk with your doctor about how to get off it. Unless you withdraw very slowly, getting off the medication will precipitate a depression because your body has forgotten how to just keep normal emotions going.
Okay. So you don't want people to just drop their pills from reading a book.
No. Right. They can work toward getting off them.
Well, it's nice to know when you have prescriptions without pills that there are ways to manage your emotions that seem really severe without a pill. because everybody's on a bunch of pills, and most people don't want to be on a pill. Even a lot of times people who are even addicted don't even necessarily want to be that way, but they're scared to admit. Nobody wants to admit that they're addicted, first of all. So,
or drug dependent in the case of the antidepressant category.
Yes. So prescription without pills. Dr. Heitler, where can we find your book?
Our Prescriptions Without Pills is either available on the bookshelves of your local bookstore, or they can order it, or just go to the web, write in Prescriptions Without Pills, or go to my website, prescriptionswithoutpills.com, and click there. That hooks you up, I think, with Amazon. But better to support your local bookstore.
Well, this book is very timely because America is over-medicated. As I said, there are more prescriptions for emotional issues written than there are people in the country. And a lot of people, they don't want it anymore. They're fed up. And so, Dr. Heitler, I thank you so much for writing the book. And I thank you for being on Dr. Veronica's Wellness Revolution. Thank you so much.
Absolutely my pleasure to talk with you.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.